Welcome back. And so now we're going to start looking at how we get our pharmaceutical products once they've been developed and trialed and approved, how we get them into our patient and how we monitor what dosage is required in order to have that effective therapeutic effect that we want in order to treat disease or just increase the patient comfort, whatever our drug is trying to do. So there are a number of things that we need to know for this in terms of being assessed. One of those is being able to talk about the therapeutic index. So looking at the therapeutic index derived from animal studies, as well as that derived from human studies and the differences between the two. We need to look at the range of doses that are involved in drug delivery, from minimum amounts through to those that are the maximum amounts that we can deliver safely. We need to consider things like dosage, terminology such as tolerance, addiction, and side effects, and what these mean in the context of our pharmaceutical products. We also need to look at how much of our drug gets through to the target that we had intended it to. So remember, we have target selection for any of our drugs when we go to produce them. So then when we look at actually administering them, we need to look at what portion of the drug that we administer is actually getting through to our target. Then we need to look at how we go about looking at structures, synthesis, and extraction to produce highest possible yield, which is something that we will look at a little bit later on, especially in terms of purity and so forth like that. So there are a huge number of ways of which we can get a drug into a patient. That can be orally, which is one that we're very familiar with. So this is through the form of a tablet or a syrup or anything like that. Pulmonary, which means through the lungs, so through inhalation. Transdermal, dermal meaning skin, so this can be through the skin, so patches and things like that. Injectables, of course, so getting needles. Ocular means through the eye. Nasal, such as nasal sprays for antihistamines and things like that. Topical means on the skin, whereas transdermal means through the skin. Okay, implantable, so things like Implanon for young women will often these days can get an implant into their arm, and there are other slow release implants that we can use, and transmucosal, which is basically anything that is passing through a mucous membrane, such as the wall of the mouth, the ear, and various other mucous membranes. Okay, so essentially with drug design, we need to know how we're going to get it into the body, how we're going to get it to its target, and then with that, how that route of administration goes will also determine the stability of our drug and what we need to do in order to protect it a bit from what our body will do to it along the way. Our drugs are particularly good at removing foreign bodies or foreign chemicals or breaking things down, because that's what we do when we eat food, we break down chemicals. So we need to make sure that our drugs will last long enough to get to our target and make sure that they will have the effect that we want. So we have a number of different ways that we can do this. So while there's all these different ways that we've mentioned, not all of them are within the scope of our course. Okay, so we will look at the ones that are in our course with more detail, and just mention a couple of others that you may come into contact with in your everyday life as well. One thing to note with this is it's particularly interesting from a international standpoint or global thinking standpoint, that the cultural norms that we grow up with can also have an influence on the way that we are comfortable taking drugs or having drugs administered to us, or right down to the color of the drug that we associate with different effects. So different creams or different things like that, the color of them can actually influence what we think they would be used for, and our compliance or tendency to use them for different ailments as well. It's actually a very interesting area of research. So the first one I'm going to look at is oral delivery. This is anything taken in via the mouth. So it can be in the form of syrups such as cough syrups that you might have taken, capsules or caplets that contain powder or liquid or any other number of variety of things, or just straight tablets. Essentially, it is when we consume the therapeutic ingredient via into our digestive system. One of the things that this is particularly good for is it's convenient. We can carry the medication with us, take it easily in a small dosage. We don't need any specialist equipment in order to deliver this medication. It's pretty easy to be able to swallow a tablet. The disadvantages, however, are that our drug needs to be stable in our stomach acid. Because it's got to be able to go into our stomach and survive our digestive processes enough to get to our target. It can have a long lag time. It's dependent on the rate of digestion, which can also be subject to illness and things like that. So if someone's having digestive problems, an oral medication may not be the best route for that. Depending on the side effects, some oral medications can cause bleeding or vomiting and other side effects like that, which you don't want. And our rate of absorption can actually be quite low. Usually for oral administration, we have to administer a large amount of the drug than what's actually required, because a good proportion of it will get broken down during the digestive system. The other thing is, if we have an unconscious patient or someone who has an obstruction in their throat or otherwise, they're unable to take medication via swallowing. This can also be difficult, in particular for young infants. Getting them to swallow tablets is pretty hard, which is where we usually get liquid medications and formulations from. But in general, the most prevalent form of medication that we tend to see in our day-to-day lives is oral delivery, be it for vitamins, pain tablets, antibiotics. These are the most common routes that we see our drugs administered. So parenteral delivery is anything delivered by injection. Now we need to know these in a fair amount of detail, so bear with me while we go through these. We use an injection anytime we need fast action or delivery. Okay, so if you think about it, with an oral medication, we have that lag time as we wait for it to be absorbed into our bloodstream. In terms of an injection, we're putting it straight away, either right where it needs to go at the time or directly into the bloodstream. So things like adrenaline, when we have someone who's having an anaphylactic attack, they need adrenaline, that will be delivered by injection. Insulin in diabetics also will give us a quick response in order to be able to even out somebody's blood sugar as well. Okay, so while there are different types of injection, and even transdermal and implants can be considered a type of injection, there are three that we need to know about. These are the subcutaneous, intravenous, and intramuscular, and we need to be able to list the different advantages and disadvantages of each of these and be able to compare and contrast. So let's get going. Intravenous, okay, so intra means within and venous is vein. So this is where we take the injection and we place it directly into the vein and deliver the drug into the bloodstream. Okay, so if anyone's had antibiotics or fluids delivered at a hospital, or you've been hospitalized, this catheter here is what they often use to deliver straight in. It's a lot more flexible than the rigid metallic needle which they may use to get the catheter in originally, but these will sit in and directly place the drug into the bloodstream. Okay, so this is going straight into the veins. It gives an immediate impact. It's the fasted method. Blood gets pumped through our body quite quickly. So as soon as we put the drug into the bloodstream, it starts to get pumped around the blood and will get, the drug will take effect very quickly in its target area. So we tend to use this for anesthetics anytime that we need to get a patient with an anesthetic, be it local or a general anesthetic. Okay, or it can be used when we need to deliver a drug for a long period of time, such as an IV bag to get fluids directly into our patient to hydrate them, or a long-term administration of a chemotherapeutic agent or antibiotic. We'll use this directly into the vein, so we're not having to wake people up all the time to take medications or otherwise, and that it is as fast as possible. Okay, the other thing that allows us to do is deliver a very precise amount of drug into the drug stream and know exactly how much of it is going to be effective. When we take medications via the oral route, people's individual digestive processes and things like that can actually have an influence on how much gets through into the effective target. Intramuscular, again, okay, you'll notice we're going to a slightly different area here in this subsection that we see here, and that the needle actually looks to be a lot larger. Intramuscular needles do tend to be bigger. They need to go into our muscle, and when the muscle clamps, not be broken, so they tend to have a wider needle. We tend to give things such as antibiotics, even that adrenaline when we're doing anaphylaxis. Anyone who's trained with an EpiPen in first aid, we're told to put that into the upper thigh, into the muscular part there. Vaccines are often given into the muscle. You would have experienced those into your upper arm and quite often hurt. Intramuscular needles can be quite painful. When we do this, we're generally trying to administer a large volume of drug. So vaccines, we usually have to get a good few mil into someone like that. Adrenaline, those kinds of things when we need to deliver a large volume and they don't need to act as quickly, we can deliver intramuscularly into our muscles. The third type that we have is subcutaneous. So this is simply, the other time we'll hear this is called subdermal. These are simply put into the skin. They sit just beneath or under the skin layers, which are still vascularized, but we're not going into the vein or the muscle. Okay, so generally this is what's happening when your dentist is giving you an injection before working on your tooth, because your tooth tends to sit, if this is our gum line, your tooth sort of tends to sit in here and the nerves are in here. So you get a subcutaneous injection in around here because we want to numb around those nerve endings. Okay, so dental injections, insulin, again, we want slower release of these, so absorption is needed over a longer period of time. So the drug tends to go at a slower rate than intravenous. It is faster than intramuscular though. Okay, so we use subcutaneous or injections when we want something to be absorbed over time, but faster than when we have, say, an intramuscular disease. Injection. Okay, so essentially, you may know someone who has an insulin pump. So there's different ways we can administer insulin through a direct injection, which pushes the insulin into this subcutaneous layer here, or via a jet injector, which sort of does a spray through into this layer, or sometimes you may actually know someone who has an insulin pump, which is essentially has a very fine tube, much like the cannula we saw on the catheters in intravenous, but this time a very fine tube sits into this subcutaneous layer and slowly administers the insulin over time, which gives a slow release and keeps things more steady. Okay, the other couple, we've got a couple more before we finish this one, so bear with me. Suppositories are one way that we can administer drugs for people who perhaps are having issues keeping things down. So if you have a disease or an illness that is causing you to vomit a lot, an oral medication isn't necessarily going to work. So you might have something or might be on a treatment that causes a lot of vomiting. Generally, patient compliance, we try not to give people needles too often. People aren't very fond of needles. So we tend to have higher patient compliance if we avoid things like needles. So if you have a small child that's undergoing convulsions and wouldn't be able to take medication, or extreme nausea or vomiting, or following surgical procedures perhaps where a patient can't swallow anymore, we'll use a suppository. So a suppository is inserted into the rectum and it's absorbed through the membrane of the large intestine. Okay, so we were talking about mucus delivery. So this is through the the rectal mucosa, and it's directly absorbed into the bloodstream. We avoid all the digestive tract issues and just go straight into this absorbent part of our digestive tract. It's faster than therapeutic because it doesn't have to go through our stomach and our liver and into the blood. It goes straight through the mucosa into the bloodstream. And we can use it to deliver things such as laxatives, some pain medications, such as Panadol or acetaminophen, and also vasoconstrictors and things like that to treat different types of ailments. One of the other common ones that most of you will have come in contact with is pulmonary delivery through inhalation. Generally, we use this for drugs that are very fine powders, volatile liquids, or sprays. And in this case, we are using the high surface area of the lungs and the high vascular nature, so lots of blood that gets passed through the lungs, in order to inhale the drug and use those mucous membranes in our lungs to transfer that drug directly into our bloodstream. So typically we see this used for respiratory illnesses such as asthma, where we want the drug to work on the pathways down into the lungs as well as the lungs themselves. General anesthetic, a lot of people usually you may have heard of people being gassed or given nitrous oxide before general anesthesia, which can calm people and give them a slight numbing feeling. It's also one of the most common ways for illicit substances such as cocaine, or like you may have heard of crack pipes and things like that. Also tobacco. Okay, so these drugs we all deliver through our lungs. So just a quick mention on asthma. So, okay, if we think about it, on the left here is a normal airway. So in asthma sufferers, that airway is actually blocked and can become inflamed. So generally without an attack, it's fairly blocked. And then during an attack, that swells and tightens. So when we're delivering asthma medications, it's important to try and have them quite volatile and able to pass down into the airway so that they can directly work on those areas in the airways so that the person can start breathing again. So this is why we tend to have direct during an attack, direct delivery of the therapeutic agent through maybe a nebulizer, so a mist, or through a inhaler or puffer like that. Okay, eye and eardrops, not technically part of our study design anymore, but possibly ones that you've seen. So we use eye drops for treating glaucoma and other problems with the eyes, or if you've gone to an ophthalmologist or optometrist, they may have put drops into your eyes to make your pupils dilate as well. So these are usually being put into directly into the area where there's a problem, so antibiotics for earache or things like that, and generally have high patient compliance. So while it might be a little bit uncomfortable, there's no direct pain associated with it, and again, no specialist equipment required to deliver the drug. Transdermal and topical, again, not something that will come up in your exams very much, but is a good idea to understand. These ones both involve the skin and are non-invasive. So transdermal are, again, slow, sustained release, and they use these for hormone replacement treatments, or nicotine patches also use the same technology where the drug is put into a matrix and it has these actually very, very fine needles which just prick the skin a little bit and allow the drug to pass through the skin a lot more easily. Other ones that we know are topical creams such as burn lotions, or sunscreen lotion is even considered a topical treatment. Okay, so this is where the medicine needs to be applied directly to the site or to the wound and rubbed directly onto the skin. Sometimes it can transfer through, sometimes its purpose is purely to sit on the top, such as with a sunscreen. Okay, I might actually leave this here and start our next video talking about bioavailability and some of the other ways that we can increase that in terms of our blood access to drugs. So make sure that you are familiar with each of the different types of drug delivery, particularly the 3 types of injections and our oral and pulmonary delivery, because they're particularly important for us to have a good understanding of.